So weight loss versus fat loss, which is better and what's the difference?
In fact, there is no magic or there's no cheat code for bringing total body fat down.
Most of the drugs, they come with a label saying that you have to still exercise.
Lifestyle is nothing but diet and exercise. What
No
you
shortcuts.
Eat, absolutely. What you eat and how much you work out, these are all very important.
We've all seen in the headlines, there's a new drug on the block which is making waves and it's rumored to be a favorite among the celebrities for the weight loss. So is this a new game changer for India or is it just the buzz? So let's find out and know more on our today's Health Talk episode. Joining our discussion today is Dr. Dilip Gude, Senior Consultant Physician and Diabetologist from Yashoda Hospitals, Somajiguda. Welcome to the program, Dr. Dilip, and it's always good to have you.
You too.
So Dr. Dilip, with years of experience in treating patients with diabetes, how has your medical journey evolved and how has your perspective changed?
So it's been 17 to 18 years that I've been practicing diabetes hardcore, and for the last 10 to 12 years, there is a paradigm shift of diabetes management, and that is something which ADA, American Diabetic Association, has recommended. So there is a clear-cut guideline-based therapy that ADA and even India's own bodies like RSSDI, EASD, all these have recommended that there be less emphasis on pancreatic beta cell insulin secretion, as in beta cells of the pancreas need to be saved, and give medicines that help patients control their sugar, with mechanisms that are extra pancreatic. So like there's a class that excretes sugar into urine. Basically, these are called SGLT2 inhibitors. So these medicines are known to actually bring down heart disease risk, kidney disease risk. They are also going to bring down total body weight as well. Now, there's another class of medicines that ADA has been recommending, which are semaglutide, tirzepatide, liraglutide and all. This is a revolution basically in diabetes management, and now the whole focus is now changing towards bringing down total body fat, especially if they're obese.
So there is a connection between obesity and diabetes and it's a vicious circle or something?
Absolutely. So insulin resistance is something where there is centripetal obesity, fat in the visceral fat basically. The pillars of metabolic syndrome are increased obesity, blood pressure, diabetes, high triglycerides and all. So all of these, there's a direct link with insulin sensitivity. So it is like a common soil hypothesis where there is one pillar that is causing one to develop diabetes, pre-hypertension or hypertension itself, and then dyslipidemia, that is bad cholesterol being high, good cholesterol being low, and then visceral fat as well. So it is actually when you hit this particular pillar, which is the common soil hypothesis, you are actually helping the patient become non-diabetic as well.
So we know that, there are pills which help us fight your diabetes, or there are some pills which help you get the migraine done. But today we are talking about a pill which helps you lose the weight, which we have seen it in the headlines. So is this the new cheat code for life today? How would you like to explain this?
I wouldn't say cheat code. In fact, there is no magic or there's no cheat code for bringing total body fat down, becoming a pre-diabetic or non-diabetic from, on one extreme if you're a diabetic. So it's a spectrum basically. So when you start bringing down your total body fat or visceral fat down, there is a journey that you're beginning from becoming a diabetic towards becoming pre-diabetic or even non-diabetic. So now for that, there are not just one medicine, but there are a plethora. There are 3-4 medicines actually. In India right now, as of now, we only have medicines that they're okay for diabetics basically. You want these medicines to be used when you want diabetes to improve. But for obesity, basically, in 6 months or probably 1 year, we're going to have these two wonder drugs, basically, tirzepatide and semaglutide at a higher dose, available as injectables. So with these, and of course, coupled with lifestyle changes like diet and exercise, the journey towards becoming a pre-diabetic or non-diabetic is definitely possible, and the horizons definitely seem bright.
But just popping a pill and then you see it's like a magic, you've lost all your weight. I mean, is it magic or is it science or is it mix of both? How would you like to explain this to a 5-year-old, for example?
It is entirely science. There's no magic in it, basically. There is a clear-cut mechanism through which these medicines act. They bring down your appetite, basically. You don't feel like eating. If you were eating, say, 3 rotis, for example, you would feel full when you eat not even 1 roti now. So your appetite basically comes down drastically. The intestinal transit time, so the time that intestines take to digest and propel the food, it is longer. right? So you feel sate, or your satiety level is maximum when you eat just 1/3 of how much you were eating before. Then you're looking at a phenomenal 30% weight loss basically, and that is something which we have not seen happen so far. Even bariatric surgeons, when there is bariatric surgery done, you expect 25 to 30, or in some cases 35 to even 40% weight loss. But with these miracle drugs, of course, backed by science and the safety, for long-term safety basically, with these, where we're traveling, we're going to have drugs that can help people reverse their obesity and diabetes for long term.
So it means like you can just pop up these pills and still grab your pizza or jump or miss your gym session? Is it something like that?
Absolutely not, I would say, because lifestyle remains the pillar. Lifestyle is nothing but diet and exercise. What
No
you eat,
shortcuts.
absolutely. What you eat and how much you work out, these are all very important. They continue to stay important. Now, we're only going to have an add-on. So while diet and exercise form 70%, 30% is going to be helped by these new molecules. But there is no shortcut. I mean, these are not cheat codes. You cannot have high calorie sweets and all and then think that since I'm on these classes already, I will get my weight loss and all. No. So these are not shortcuts. Diet and exercise continue to remain as important as ever. So these are only add-ons which will help you reach your goal faster and probably maintain that lost weight for a longer term.
So who are these medications for? I mean, is there a special group of people who can receive this medication? I mean, is there any secret weight loss club people?
So the subsets of patients that ADA recommends basically is obese diabetic. Now that subset has been expanded to obese patients alone, as in obese non-diabetic patients are also being prescribed these medicines with phenomenal results, that is. But it is actually easier for an obese diabetic to lose weight. Basically, when you shift, when you're going to change the medicines that the patient is on, insulin being an anabolic hormone makes the patient gain weight. Right, so bringing down the total body weight basically helps you, your total daily dose of insulin also comes down. So with these molecules, over a period of time, you may actually not require any external insulin at all. So you are probably shifting this paradigm completely. You are making them non-diabetic by actually bringing down total daily dose of insulin, but removing sulfonylureas completely.
Okay.
And then while adding these classes of GLP-1 receptor agonists, GIP as well, and SGLT inhibitors as well, and of course other classes like acarbose, metformin, orlistat and others.
So you see the change over a period of time and not just like, within a night or something? Absolutely
not. So the time frame ranges from person to person. Basically, we are looking at, say, 6 months to 1 year. If you are looking at 20 to 25% weight loss, we are looking at 6 months to 1 year. But then the most important pertinent question would be, will these people gain their lost weight back? So now that depends again on the person's lifestyle. We're not going to give these medicines forever, right? When they lose 25 to 30%, you will probably bring down the dose as much possible. And in some patients, you can actually stop. But then you will have to tell them how important it is to adhere to diet and exercise.
It's more of a journey and not just a destination.
Absolutely. It takes time. And once they reach that particular destination as well, it is important for them to maintain that particular weight.
And I'm sure during this entire journey, they must have, also tuned their mind and they've come to a certain lifestyle change and they know how important it is to stay off the weight.
There are some neurotransmitter changes that occur, neurohumoral changes in a beneficial way. So these help them maintain, their cravings. They don't go back to their, craving junk food, pastries and all those.
So what's the catch? I mean, are there any side effects that makes you question the trade-off? I mean, using these medications for a long time?
So honestly, for the first few months, or say 45 days, 1 month to 45 days or so, they will have some gastrointestinal, problems. I would not say side effects. These are not really side effects. These are probably effects, I would say.
Some disturbances.
Yes, they may have bloating, like reflux might be pronounced, gastroesophageal reflux. They may have borboremy, we call it, the gas, going from up or even down. Then they may have constipation, they may have flatulence, diarrhea and all, but these all will settle down with time. But if you're talking about long-term side effects, I don't think there are any. But those who have had chronic pancreatitis, we don't tend to start them on these at all. And then very rarely, probably 1 in 100,000, may have had medullary thyroid carcinoma, but not in humans. We have seen that happen in trials in animal trials, but in human trials, medullary thyroid carcinoma increase has not been there with most of the subjects that have been on these particular classes.
But on a personal note, did you ever try these medications just to see? I mean, what's the secret for your fitness?
Oh, I have not used semaglutide or liraglutide or any of these so far yet. My secret is what I practice what I preach. I mean, I want the kind of diet that I tell my diabetic patients, I follow that myself. So I think that is the dictum. When you're saying a diabetic diet, you're trying to tell people to reduce carb intake, remove sugar completely as much possible, remove jaggery, honey, sweets and all those. So that is something which I follow myself, and I think we all should do that. So even a non-diabetic patient should eat like a diabetic in simpler terms. So we all should cut down these high-calorie diet, junk food, fried foods basically, cut down processed foods. That's what I would recommend.
So we tend to see these medications working differently on different people. So is there a secret body chemistry lottery situation kind of a thing?
So the quantum of weight loss, the degree, 25, 30% or so, may not occur with everybody. Now that again depends on body nature, the kind of genetics that each person is made of. So yeah, it tends to be 25 to 30% weight loss. It varies. It's not a uniform thing. Again, for that diet and kind of exercise that people do, the quantum of it, the degree of it, the number of minutes per week, if you see, and then are they doing cardio and weights? Then what kind of food they're taking, along with the kind of the medicines that we're prescribing. So it is always a complex array, basically. It is not one subset or one percentage of weight loss for everybody.
So weight loss versus fat loss, which is better and what's the difference?
So with these molecules, when I say patients lose 25 to 30%, it's not entirely fat, although 90% of it is fat that they're losing. So there is some degree of muscle bulk that they may lose, but then you can make it up for it by working out. The quantum, predominantly what the weight that they're all losing is all fat. And there are actually studies done which are corroborating this. They've established that whatever weight loss, 25 to 30% weight loss, that most people have gained is all actually fat that they're losing.
So weight loss drug versus bariatric surgery. What's your take?
So bariatric surgery is definitely, the indication stays. 40 or more BMI, 35 or more with diabetes, hypertension, so many problems, osteoarthritis and all those. Definitely the indication remains. But then probably 20% of bariatric surgery recommended patients, they may not qualify for it. So if that is the case, we have alternatives like these drugs, and that is why the term medical bariatrics. You can probably achieve 80% of what these bariatric surgeries are achieving through medicines.
Dr. Dilip, what's the cost of these drugs? I mean, do we have to skip a vacation or something like this? What is it actually?
Yes. So for now, semaglutide is expensive. In fact, in India, we only have oral semaglutide, Rybelsus. And the 14 mg dose that is actually prescribed is actually costing somewhere around 370 rupees one tablet. We are looking at probably 11,000 or so per month. So it is expensive, no doubt. And the medicines that we discussed about, tirzepatide, then high-dose semaglutide are probably going to cost 15,000 or even 20,000 per month. So these are definitely expensive, but probably with time passing, maybe 4 or 5 years down the lane, we are looking at these medicines becoming cheaper. But there is no amount of cost that you can put on healthy, BMI. So when you're preventing heart disease, when you're preventing diabetes onset itself, when you're protecting your kidney and heart, then it is definitely worth.
So if you were to create a weight loss drug, what would it taste like and what would it do perfectly?
Yeah, so that's a nice question. Taste as in, most drugs are not really, tasty, right? The ideal weight loss drug should actually help you, your appetite come down. Okay, you shouldn't be having the cravings. Your total body fat, your visceral fat mainly should come down. And then your blood pressure also should improve. And then, of course, your LDL should become normal, which is the bad cholesterol coming down, your good cholesterol going up, and your cardiorespiratory reserve should improve.
So what is one myth that you wish people stop believing about weight loss drugs?
That there are long-term complications or side effects, because absolutely there are none. 12 years is a reasonably long period of time. And I mean, by now we would have known if there are any long-term side effects. So these are safe medicines, but the only thing, the indication is not for everybody. And then don't be under the superstition that, if you have diabetes, you can completely reverse it. You may not completely reverse it, but you can definitely improve your diabetes. And in some subset of patients, probably like half of them, you can actually help them become non-diabetic.
But most of the drugs, they come with a label saying that you have to still exercise.
Right.
Which most people maybe tend to ignore it later. So what do you think the future of weight loss drug is going to be, especially in our country?
We can't really label these drugs as weight loss drugs because it is not just weight loss they are targeting. There is a metabolic profile that is being changed, and you're going to have lesser number of heart attacks, as in your heart attack risk comes down, your heart failure risk comes down, your kidney disease risk also comes down. So it is not just one thing that we're targeting. It's not just weight loss or diabetes, but metabolically you're going to live longer. So it's not just one parameter these weight loss drugs improve, but it is a plethora. It's multidisciplinary improvement that we are looking at.
So before we wrap this episode, Dr. Dilip, is there any message that you would like to share with our audience out there?
Yeah, so I think my advice would be try to reach your healthy BMI. In fact, if your BMI is in the healthy range, there's a very good chance you may become a non-diabetic. Or you may actually start your journey towards becoming non-diabetic, maybe pre-diabetic now and probably non-diabetic in the coming future. So eat right, and wherever required, discuss with your doctor these new medicines. Most importantly, lifestyle changes, which is diet and exercise.
So thank you, Dr. Dilip. It was wonderful interacting with you on our episode today.
Likewise.
So this brings us to the end of this episode. Hope this episode was informative on the topic weight loss medications. And remember, weight is not just about the number on the weighing scale, but it's about your overall well-being. And don't forget to tune in for next week as well. Until then, take care and stay healthy. Thank you.